and your spouse and you get emotional and you hug them and love, you know. Love is not going to save us. Sense is the most important thing right now. In a situation like this, it is sensible, responsible, conscious behavior which is going to be the winner of this. There is simply no other solution that anybody has come up with. We have only learned to postpone. Vaccination is a good way to postpone, but vaccination also is not a permanent solution. But at this time, it is very important that everybody gets vaccinated. There's a whole lot of people who are internet scientists who are picking up bits and pieces from all over the place and talking about all the different negativities of vaccination. I want you to understand, every vaccination you have taken in your childhood of diphtheria, of smallpox and whatever else you have taken, all of them had an element of harm, an element of risk in them. But we took them, it's because of that most of us are alive today. So the same goes for this vaccine. Does it have an element of risk? Yes, but it has been substantially established the element of risk is minuscule and it is worth neglecting it right now, because right now the risk of infection and fatality from that is much, much higher. We need to understand health is not an absolute thing. Health is something that we achieve incrementally. So the same thing goes for the vaccination. Right now, vaccination is a must for everybody. Nobody should evolve philosophies of anti-vax. This is just rubbish right now, putting everybody's life to risk. Well, if you want to be anti-vax, go and live on a Himalayan peak where you're not in touch with any human being, it's fine. But if you're living in a city, town or a community, you must take vaccination right now. Is this a final ultimate solution for this pandemic? No. At least it'll give us a break of 6 to 9 months. We can postpone it. In this postponement, probably a little more awareness and consciousness will come and we clearly understand the risk that we're putting ourselves into and putting everybody else around us. Especially in the yoga center, there are many people who are over 65, 70 years of age. As I've told you, all the young people there, it's your responsibility to ensure that we will not have a single fatality in the yoga center. I want that commitment to spread to the rest of the meditator community. You have to ensure you will not die and nobody around you dies. This is the only way. This is the only way. There is no magic wand solution anywhere. This is the only way, and this may be a long haul. How long? We don't know, but it could be a very long haul. It may change the very way we exist on this planet, it's possible. Or if virus just decides and just fades off, as sometimes it is done in the past, some of the viruses have done that. If such a thing happens, well, we are very fortunate, but if such a bonus comes our way, we will definitely enjoy it. But right now, thinking of such fanciful dreams is not the right thing to do. It's very, very, very important. Everybody must see how to bring aspects into their life, how to eat properly so that our oxygen levels and immune system is good, how to live properly so that our oxygen levels and immune system is fighting fit, and how to do what practices to do to achieve the same thing. This should be the focus right now, and the whole country or the whole world should move in this direction. And International Day of Yoga is coming. It is very important that all of you become instruments, because you are not just teaching a simple practice, you could be saving their life. Please make this happen for yourself and everybody around you. This is the time to stand up and show what kind of human beings we are, what are we made of. This is not a time for frustration. This is not a time for depression. This is not a time to come into a state of despair. This is a time to stay calm, to stay equanimous and do the right thing. The right thing is not a spectacular, heroic act. Right thing is simple. Wearing a mask is not heroic, but it is heroic, believe me. Keeping social distance doesn't look so spectacular, but it is a spectacular act because this can save your life and everybody's life around you. Please, these things you must maintain. Having been on a spiritual path, claiming that there is awareness in you, that you are spiritually oriented, if you can't manage these things, it means nothing. All spirituality will mean nothing because you will be risking your life and putting everybody else to risk. So it's important that in different regions, meditators organize support groups, and in the support groups, it is not a must that everybody must be a meditator. If you make them do Simha Kriya, they have become meditators, all right? Do not think meditator means they must have gone through an engineering program. They are doing Simha Kriya, they watch 3 videos, they are meditators for us, or they did nothing. Still, if they are willing human beings, they can be part of this and ensure that we are able to facilitate a few things. We are not doctors, not all of us are doctors, not all of us are in the administration to do some significant things, but wherever facilitation is missing, right now the biggest problem is the number of medical personnel we have is not enough for the number of people who are falling sick. When I say medical personnel, don't think only of doctors. The most important care workers in this are the nurses and the next level of paramedics who are there, because they are the ones who can do this work. Because there is no diagnosis involved, just a test is negative and all the symptoms are there, everybody knows what the symptoms are. So there is not too much work for a doctor except in emergency situations. Largely it is nursing work. I'm saying all of you in some way can very easily learn a few things, that when there is an emergency, when somebody gets sick, should we rush everybody to the hospital? Not necessary. Or can we teach all the families around us as to, in case it happens to your family, what are the things to do? Because panic, when somebody in the family gets sick, the panic is costing too much for the country. Somebody panics and they rush their people to the hospital, whether they deserve, whether they need, deserve is not the word, I'm sorry, whether they need the hospital bed or not, whether they need the oxygen or not, family will demand, we want oxygen, we want bed. But somebody else who really needs it may not get it because somebody else who could manage without it, unfortunately, is occupying the bed. But this is happening out of emotional reactions for family well-being. So, educating people, we will put out more and more notifications, make sure this reaches maximum number of people, educating people how you can nurse a COVID sick person at home without taking it beyond a limit, what are the things you can do, what support you can get, because more and more people get treated at home, more people are nursed to health at home, will be a simple way of avoiding thousands of deaths which are happening in the corridors of the hospitals. This is very, very important. This is a responsibility that all of you should take it up. And we will see in the region how the Ishangas can come and organize, or by video or audio they will organize these things for you, help you through this, but form self-help groups of your own so that among yourself there is strength, there is no panic, there is no sense of being lost, lost in this world by yourself. There is a community around you, strong, willing to support you on all levels, and we will see what we can do. And of course, we have released a little bit of fund, but this will not be enough. Please, those of you who can raise fund, crowdfunding, whatever other resources, please do whatever you can, because there is much to be done, particularly in the rural areas which doesn't come into media glare, but there are people there. There are more people in rural India than in urban India, so there are real people there and their lives are also at risk. Fortunately, generally they are far more resilient, their immune systems are better than the city people, but still this does not mean they're not at risk, because deaths are happening in rural areas also. So we want to see how we can support this not so privileged society in the country, and this is also the region of the country where there